If you are over 60, your heart has already performed a quiet miracle. It has beaten more than 2 billion times, adapting to stress, joy, loss, and recovery without ever asking for recognition. Most people never pause to consider that endurance. They only notice the heart when it falters, when stairs feel steeper, or when fatigue lingers longer than it used to. Yet, inside your chest, this organ has been learning, compensating, and surviving for decades, guided by biology that is far more adaptable than we once believed. From the perspective of a cardiac surgeon, the operating room reveals something deeply humbling. Two people of the same age can have hearts that look radically different. One may be stiff, inflamed, and fragile. The other, supple, resilient, and strong. The difference is rarely luck alone. It is shaped by patterns repeated quietly at home, long before a hospital bed is ever involved. This is why many surgeons speak less about heroics in surgery and more about what happens in kitchens, bedrooms, and daily routines. Large population studies following older adults for years show a striking truth. Lifestyle patterns influence whether hearts age rapidly or slowly. In some research, favorable habits are associated with meaningfully lower rates of cardiovascular events and death later in life, even after 60. That finding reframes aging itself. It suggests that decline is not simply a calendar process, but a biological conversation, one your heart is still having with you. The question is no longer whether change matters at this age. The real question is which changes carry the most protective weight, and why so many people never hear about them until it is too late. As the years pass, the heart and blood vessels are asked to work under different conditions than they once did. Arteries that were elastic in youth gradually stiffen, forcing the heart to pump against higher resistance. Low-grade inflammation becomes more common, quietly irritating vessel walls and altering how cholesterol behaves. Muscle cells in the heart may lose some of their efficiency, while the body as a whole becomes more prone to insulin resistance. None of this happens overnight, and that is precisely why it is so easy to overlook. Many older adults recognize these changes only through daily inconveniences. Climbing stairs brings shortness of breath where there was once ease. Ankles swell by evening. Energy fades faster than expected. Medications slowly accumulate, each one addressing a symptom rather than the underlying load placed on the cardiovascular system over decades. These experiences are common, but they are not meaningless. They are signals of a heart adapting to long-term pressure. What often goes unsaid is that aging biology remains responsive well into later decades of life. Research following adults over 60 shows that targeted lifestyle shifts can still reduce heart-related events and mortality by meaningful margins, even when changes began later rather than earlier. This challenges the quiet belief that the damage is already done. In reality, blood vessels retain an ability to relax, inflammation can be calmed, and metabolic efficiency can improve, even in advanced age. Most people never realize that the heart is not simply wearing out, but constantly remodeling itself in response to daily inputs. Food choices, movement patterns, sleep, and stress either increase the strain or quietly ease it. Once you understand this, aging no longer feels like a one-way descent. It begins to look more like a terrain you can still influence, step by step, with the right kind of support. Among cardiac surgeons, there is an unspoken agreement about the most powerful support for an aging heart. It is not found in a bottle, and it is not delivered through an IV line. It is a pattern of eating that works with human biology rather than against it, shaping inflammation, cholesterol behavior, and vascular function every single day. This is why a Mediterranean-style way of eating is often described as daily medicine without a pill. When researchers study older adults who follow this pattern closely, the results are consistent and compelling. Large reviews and long-term cohort studies in people over 60 associate high adherence with substantially lower all-cause mortality and fewer cardiovascular events, with reductions often in the range of 20 to 30% compared to low adherence groups. Sophie et al., 2010. These benefits appear even when changes begin later in life, suggesting the heart remains responsive to nutritional signals well into older age. What matters most is not rigid rules, but the overall rhythm of the plate. Vegetables, fruits, whole grains, legumes, nuts, and olive oil form the foundation. Fish appears regularly, while red meat and sweets step back into occasional roles. This pattern influences blood lipids, reduces oxidative stress, and supports healthier endothelial function, the delicate lining that allows arteries to relax and respond to blood flow demands. Many people assume heart-supportive eating requires deprivation. In reality, this approach often increases pleasure and satisfaction, which is one reason adherence remains higher than with restrictive diets. The heart does not respond to perfection, it responds to consistency. Each meal becomes a small biological message, reinforcing either inflammation or repair. The quiet power of this pattern lies in repetition. Over weeks and months, it changes the internal environment the heart must work within. That is how food, chosen thoughtfully, becomes a long-term protector rather than a temporary fix. To understand why this way of eating protects the heart so reliably, it helps to picture what it looks like in real life, not in charts or guidelines. Imagine a morning that begins with a warm bowl of oats, dotted with berries and a small handful of nuts. This combination delivers fiber that steadies blood sugar, plant compounds that calm oxidative stress, and healthy fats that support vessel flexibility. Most people never realize how strongly the first meal of the day can influence vascular tone hours later. Midday might bring a lentil or bean-based soup paired with whole grain bread and vegetables dressed in olive oil. Legumes provide plant protein and soluble fiber that help regulate cholesterol metabolism, while olive oil supplies polyphenols linked to improved endothelial function in older adults. Kovas et al., 2006. The heart experiences this not as a dramatic shift, but as a gradual easing of inflammatory pressure. Dinner often feels like the most symbolic meal, yet it can remain simple. Baked fish or skinless poultry, surrounded by generous portions of vegetables and a side of beans or whole grains, sends a powerful signal of nutrient density without excess strain. Fish consumption has been associated with lower cardiovascular mortality in multiple cohort studies, particularly when it replaces processed meats rather than adding calories on top. Mozaffarian et al., 2011. The most important changes are often swaps rather than eliminations. Butter gives way to olive oil. Processed meats yield to beans, fish, or poultry. Sugary desserts become fruit paired with nuts or yogurt. These adjustments may feel modest, yet over time they reshape lipid profiles, inflammation, and vascular responsiveness. The heart does not keep score meal by meal. It responds to averages. When the average day shifts toward nourishment and balance, biology follows, quietly and predictably. A heart-supportive eating pattern must always be shaped by the realities of aging bodies, not idealized nutrition theory. For some older adults, especially those living with heart failure, excess sodium can worsen fluid retention and swelling. Many clinical guidelines emphasize moderation of salt intake to reduce hospitalizations and symptoms, but the appropriate level varies widely and should be individualized in conversation with a clinician. This is not about fear, but about precision. Another often overlooked issue is appetite and frailty. Some seniors are encouraged to eat less for years, only to find themselves losing muscle, strength, and resilience. In these cases, the Mediterranean pattern is not about restriction, but about choosing protein-rich options within the framework. Fish, yogurt, eggs, legumes, and nuts provide essential amino acids that support muscle and immune function, both of which indirectly protect the heart by preserving mobility and metabolic health. It is also important to recognize that the aging digestive system can be less forgiving. Large meals late at night, heavy in refined carbohydrates or saturated fats, may worsen reflux, sleep quality, and blood sugar control. Small adjustments in timing and composition often improve comfort and adherence, even without changing total calories. Rather than attempting a complete overhaul, research on behavior change consistently shows that small, achievable steps are more likely to persist. Choosing olive oil instead of butter, adding beans a few times per week, or including vegetables at 2 meals per day may seem simple, yet these actions accumulate biological impact over time. The heart responds not to intention, but to repetition. When a single realistic change is practiced daily for a week, it often becomes easier to add another. This gradual layering respects the nervous system, the digestive system, and the lived experience of aging, allowing protection to build quietly rather than through force.
If food shapes the internal terrain the heart must work within, movement determines how that terrain is used. From a biological perspective, physical activity is not simply burning calories, it is a signaling event. Each time muscles contract, they release molecular messages that travel through the bloodstream, improving vascular function, insulin sensitivity, and inflammatory balance. For the aging heart, these signals act like reminders of youth, urging tissues to behave more flexibly and efficiently. Aerobic movement, such as walking, has been studied across virtually every age group, including adults well into their 70s and 80s. Regular walking is associated with lower blood pressure, improved lipid profiles, and reduced risk of cardiovascular events and death in long-term observational studies. Lee et al., 2012. What often surprises people is how little intensity is required to generate benefit. The heart responds not to athletic performance, but to rhythmic demand. Strength work adds a second, equally important layer. As muscle mass declines with age, the heart must work harder to maintain circulation and metabolic control. Resistance training helps preserve muscle, improves glucose handling, and enhances functional capacity, all of which indirectly reduce cardiac strain. In older adults with established heart disease, supervised resistance training has been shown to improve physical function and quality of life without increasing risk. Williams et al., 2007. The most powerful effects appear when these two forms of movement are combined. Studies suggest that older adults who engage in both aerobic and strength activities experience greater protection than those who do either alone, likely because multiple biological pathways are activated at once. Most people never realize that movement is not stressing the heart, but training it to operate more efficiently under everyday conditions. Seen this way, movement becomes less about obligation and more about communication. Each step, each gentle lift, tells the heart how it is expected to perform in the years ahead.
What often holds older adults back from movement is not lack of will, but uncertainty. How much is enough and how much is too much? From a surgeon's perspective, the most effective pattern is rarely extreme. It is a steady blend of gentle endurance and simple strength, scaled to the body that shows up today, not the one remembered from decades ago. Walking remains the foundation because it mirrors how the heart evolved to work. A moderate pace increases blood flow, encourages vessels to dilate, and improves oxygen delivery without overwhelming the system. Research following older adults shows that even modest, regular walking is linked to meaningful reductions in mortality risk over time. When strength work is added, the picture changes further. Muscle acts as a metabolic partner to the heart, helping regulate blood sugar and reducing the workload required to move through daily life. Large population studies suggest that older adults who meet both aerobic and resistance activity patterns experience substantially lower all-cause mortality, with some cohorts showing reductions around 30% compared to inactive peers. Stamatakis et al., 2018. These are not elite athletes. They are ordinary people who moved consistently in ways their bodies could tolerate. What this looks like in practice varies. For some, it may be 20 minutes of walking most days, broken into shorter bouts. For others, it may be brief sessions of chair squats, wall push-ups, or light resistance bands on non-consecutive days. The biological signal comes from repetition, not intensity. The heart listens carefully to these signals. Each week of combined movement reinforces vascular flexibility, muscle support, and metabolic control. Most people never realize that by strengthening the legs and back, they are also easing the burden on the heart itself. In this way, movement becomes a form of quiet cooperation between muscle and myocardium, each supporting the other as the years advance.
For many seniors, the question is not whether movement is helpful, but whether it is safe. This concern is valid, especially for those who have lived with heart disease, undergone procedures, or experienced frightening symptoms in the past. The goal is never to push through warning signs, but to rebuild trust between the body and the heart, step by careful step. From a clinical perspective, safety comes from awareness rather than avoidance. The heart communicates clearly when it is under strain. New chest discomfort, marked shortness of breath, dizziness, or unusual palpitations are signals to pause and seek evaluation. Respecting these messages does not weaken the heart, it protects it. Many older adults find confidence through structured, supervised environments, such as cardiac rehabilitation programs, which combine education, monitored exercise, and gradual progression. These programs have been associated with improved functional capacity and lower mortality in people with established heart disease, including seniors. Anderson et al., 2016. It is also important to release the idea that progress must be linear. Illness, poor sleep, or emotional stress may temporarily reduce capacity. On those days, smaller movements still carry value. A 5-minute walk after a meal can improve circulation and glucose handling. Gentle stretching maintains joint mobility and blood flow. The nervous system responds to these cues with reassurance rather than alarm. Most people underestimate how adaptable the aging heart remains when it is treated with patience. Each safe, repeated movement builds confidence, both psychological and physiological. Over time, fear gives way to familiarity. The heart learns that activity is not a threat, but a partner in maintaining independence. Seen through this lens, safety is not about doing nothing. It is about choosing movements that invite the heart to participate, gradually and respectfully, in the life it is meant to support. Beyond food and movement, there are forces acting on the heart that never show up on a plate or a step counter. Sleep and stress quietly shape cardiovascular biology every single day. During deep sleep, blood pressure falls, heart rate slows, and repair processes unfold at the cellular level. When sleep is shortened or fragmented, these restorative windows shrink.
Studies link poor sleep duration and quality in older adults with higher blood pressure, impaired glucose regulation, and increased cardiovascular risk over time. Itani et al., 2017. Many people never realize that exhaustion itself can be a form of cardiac strain. Stress works through a similar hidden pathway. Chronic psychological stress keeps the nervous system tilted toward vigilance, raising stress hormones that tighten blood vessels and promote inflammation. Over months and years, this state increases the workload on the heart. Depression and social isolation have also been associated with worse outcomes after cardiac events, reminding us that emotional health is not separate from heart health, but woven into it. Small daily rituals can gently shift this biology. Dimming lights in the evening supports circadian rhythms that cue the heart and vessels to rest. Slow, deliberate breathing stimulates the parasympathetic nervous system, lowering heart rate and vascular tone within minutes. Even brief moments of calm, practiced consistently, send a powerful message of safety to the cardiovascular system. Weight balance, smoking, and alcohol habits also exert quiet pressure or relief. Stopping smoking remains one of the most effective ways to reduce heart attack and stroke risk at any age, while many experts now urge caution with alcohol in older adults, particularly those with rhythm disorders or heart failure. The heart is exquisitely sensitive to these daily signals. The question is not whether they matter, but which ones you are sending most often, especially when no one is watching. What makes these daily habits so powerful is not their intensity, but their frequency. The heart is shaped less by rare, dramatic efforts and more by what happens quietly every day. A short wind-down routine before bed, for example, can lower evening cortisol and support more stable overnight blood pressure. 10 minutes of dim light, slower breathing, or quiet reading may seem insignificant, yet repeated nightly, this practice reinforces the body's expectation of rest rather than vigilance. Stress relief does not require perfection or long sessions. One intentional pause during the day, perhaps before a meal or during prayer or reflection, can slow the heart rate and improve heart rate variability, a marker associated with better cardiovascular resilience. These brief moments remind the nervous system that it is safe to release tension, even in a busy or uncertain world. Food choices outside main meals matter as well. Replacing a sugary snack or processed meat with fruit, nuts, or yogurt alters post-meal blood sugar and lipid responses. Over time, these small substitutions reduce inflammatory exposure that would otherwise accumulate silently. Pairing this with a short walk after the largest meal of the day further improves circulation and glucose handling, especially in older adults with insulin resistance. Weight management in later life requires nuance. Modest intentional weight loss in those who are overweight has been associated with improvements in blood pressure and metabolic health, but preserving muscle is essential. This is why gentle caloric awareness combined with resistance movement is often favored over aggressive restriction. Taken together, these micro-habits form a protective rhythm. None are dramatic alone. Yet practiced daily, they lower the background noise of strain the heart must filter through. Most people never realize how much relief the heart feels when its environment becomes just a little calmer day after day. When you step back and look at the full picture, a quiet blueprint emerges, one that many cardiac surgeons wish every older adult could see long before illness forces the conversation. The first protector is a Mediterranean-style way of eating, not as a diet, but as a steady pattern that lowers inflammation, supports vessels, and feeds the heart with excess strain. The second is movement that lends walking and simple strength, reminding the heart how to work efficiently while preserving the muscles that support independence. The third is daily habit tuning, where sleep, stress, weight balance, and restorative pauses reduce the invisible load carried by the cardiovascular system. What makes this blueprint powerful is not novelty, it is alignment with human biology. These strategies do not compete with medications, procedures, or devices. They work alongside them, often enhancing their benefits by improving the terrain in which the heart must function. Research consistently shows that when lifestyle patterns improve, symptoms lessen, hospitalizations decline, and quality of life rises, even in later decades. Most people believe transformation requires force. In reality, the heart responds best to consistency. One thoughtful change from each protector, practiced week after week, can shift biology in measurable ways. Blood vessels become more responsive, metabolism steadies, energy returns in small but meaningful increments. Aging, once framed as inevitable decline, begins to feel more like a process that can be guided. The most important realization is this: your heart is still listening. It is still adapting to the signals you send through food, movement, rest, and intention. The question is not whether you are too old to influence it. The question is what message you want to send next, knowing that even now, your biology is capable of responding with resilience and strength.